For the past 20 years, the traditional medical system has failed to make any significant advancements in the treatment of sickle cell anemia. As the most common form of inherent blood disorder, sickle cell affects up to 100,000 Americans and millions of people worldwide.
Hello folks, Russ Scala here with Scala Precision Health. I want to give you a brief overview of some new research that we were looking at with sickle cell anemia after tracking data all the way back to the early 1900s. And currently with what's going on in that market right now, we see that there's a need for new treatment protocols. We had to look at diabetes, heart disease, and nutritional and hormonal deficiencies to come up with this advanced program that will slow down the symptoms of sickle cell and stop the sickle cell crisis that children and adults run into. So as we were drilling down on this, we found out that there's other options that people can look at that they may not be hearing from their physician. Number one, if we look at endothelial dysfunction, a sickle cell, when it's in the sickle shape, that only lasts 10 to 20 days, where a regular blood cell lasts 120. These sickle cell shapes damage the endothelial lining or the lining of the arteries. So if we look at our heart disease model right here, the endothelial lining or the lining of the arteries become damaged when sickle cells scratch the walls of the arteries, and when that happens, less nitric oxide is released, so the arteries are not dilated. So what this means for a sickle cell patient is they don't get enough oxygen going to their organs, and then this is where the pain starts. So a lot of the sickle cell clients that we spoke to are taking SSRIs, they're taking pain medication. The only new development in the last 20 years is a drug called Endari, which is made from L-glutamine, which makes that sickle cell a little more flexible so it doesn't damage the arteries. So what we did, and what my team did, we looked at what are the current symptoms the person is having, what medication are they taking, and how could we reduce inflammation and the sickle cell crisis that they have. If we could help with endothelial dysfunction, which means if we correct nutritional and hormonal deficiencies, that's going to keep the arteries dilated. So many sickle cell patients have an endocrinologist, they have a neurologist, they have a nephrologist, because multiple organs are starting to shut down because they're not getting the oxygen. Well, if we take the information we glean from heart attack patients and stent patients who are not getting oxygen to the muscle of the heart that beats 84,000 times a day, let's think about endothelial dysfunction on the sickle cell side, and how do we dilate the arteries? What protocols can we tie in nutritionally and hormonally that will increase the oxygen content going to the organs and decrease the person's pain?
At Scala Precision Health, we have developed a personalized gender-specific treatment protocol to combat this disease. Our program focuses on patient and physician education in an effort to diminish suffering and to improve the quality of life for all those affected.
Our focus is to look at sickle cell as an inflammatory disease. So we know that high inflammation markers, elevated white blood cell count can actually determine how long a sickle cell person has to live. What we want to do with this treatment protocol is what are all the areas that we could focus on with inflammation. We know food plays a very big part in that because certain people have allergies. Certain people have food sensitivities to even vegetables. So if the diet can play a part, we know we're going to decrease the inflammatory markers. If we look at the intestinal tract, you are not what you eat, you are what you absorb. If we could balance out the intestinal tract so you're pulling nutrients out of food and you're not deficient, that's going to bring down inflammatory markers. If we look at the mitochondria on the cellular level, if we could look at mitochondrial function and assist the mitochondria in a patient with sickle cell, which we do at our facility right now, we could actually slow down the development, increase their quality of life for the first time. I really believe that the hypothesis and where we're headed with sickle cell is it has to be treated multifactorially and it has to be gender specific. Folks, another factor we're looking at in sickle cell is nitric oxide production. We know that the arterial wall, like I mentioned, when the endothelium or the lining of the coronary arteries become damaged by those sickle cells, the arteries don't release nitric oxide. Nitric oxide is very important to keep the arteries dilated to all your veins, arteries, your most metabolically active tissue, your brain and your heart, and your liver. We have to keep those arteries open. So in sickle cell patients, the lining becomes damaged and it doesn't release that gas to make the arteries dilated. This is what leads sickle cell patients to growth hormone deficiency. And you ever notice during a sickle cell crisis, when a man or a woman or a child is under stress, it exacerbates sickle cell symptoms? Take a look. Cortisol is released when you're under stress. When we give somebody growth hormone, it elevates IGF-1. If IGF-1 is low, or growth hormone is low, and a person is under stress, it's going to slow the production of nitric oxide. So by correcting nutritional and hormonal deficiencies, focusing on insulin-like growth factor, that will protect the lining of the arteries in men and women and children, so their symptoms aren't as painful, so they could maybe come off that pain medication. So again, let me reiterate, mitochondrial function testing, that's how your body creates energy on the cellular level. The intestinal tract, you are not what you eat, you are what you absorb. We do a stool sample to determine the 1,000 different bacteria in your intestinal tract and how to slow inflammation by correcting and testing this bacteria. And then obviously your brain chemistry. This is the triad. This is the multiple metabolic systems that are interconnected that may slow the symptoms of sickle cell.
At Scala Precision Health, our team of leading researchers and physicians are the first to treat sickle cell as an inflammatory disease. Scala Precision Health leads the paradigm shift with a personalized approach to treating each patient's unique genetic and metabolic bioindividuality. The time is now for you to take control of your health. Everybody and every body has a story. Let us find out yours today.